TCCC Actual Exam Questions and Verified Answers Latest 2025-2026 Guaranteed. Question 1. Verified answers, 100%. What are the 3 criteria for safe conversion of tourniquets to hemostatic or pressure dressings? 1. Casualty is not in shock. 2. It is possible to monitor the wound closely for bleeding. 3. The tourniquet is not being used to control bleeding from an amputated extremity. 1. Casualty is not in shock. 2. It is possible to monitor the wound closely for bleeding. 3. The tourniquet is not being used to control bleeding from an amputated extremity. Question 2. You are the first responder to the scene of an improvised explosive device, i.e., attack. The area is now secure, and your next patient has multiple small lacerations over his face and torso, none of which are serious. After checking ABCs, you are sweeping his extremities with your hands, looking for painful injuries, and, upon moving his left arm, it begins to gush with arterial bleeding from a deep wound over the medial upper arm. Your first action is to tape a small 2x2 gauze dressing over the wound. Reposition the casualty's arm in an attempt to stop the bleeding. Apply digital pressure to the left radius region in an attempt to stop the venous return. E. Apply a CAT tourniquet to the arm proximal to the wound. Question 3. Which of the following factors have contributed to the combat application tourniquet being selected as the preferred tourniquet for use in combat? Check all that apply. It can be applied rapidly with one hand. It must be maintained carefully before use in order to be effective. It is small enough to be carried easily. It abolished radial and femoral arterial blood flow in approximately 75% of uses on healthy adult male test subjects. A. It can be applied rapidly with one hand. C. It is small enough to be carried easily. Question 4. Which of the following is recommended as the first-line treatment for life-threatening hemorrhage that is not amenable to tourniquet placement? Combat gauze. Occlusive pressure dressing. Hemcon. Quick clot. E. To direct digital pressure on the proximal artery and vein. A. Combat gauze. Question 5. When compared with other hemostatic agents, which of the following has the least hemostatic efficacy? Hemcon. Combat gauze. Woundstat. Celox. A. Hemcon. Question 6. While direct pressure can be an effective method for the medic/corpsman to control accessible hemorrhage, which of the following conditions of tactical casualty care are likely to prevent adequate maintenance of pressure? Check all that apply. Inability to stay with patient during transportation. Multiple injury sites. Multiple patients. Enemy fire. All of the above. Question 7. You are treating a casualty with a fragment wound to the right upper arm. You are in a tactical warm zone with good cover and this is your only patient. You initially applied a field dressing and now, 10 minutes later, it is soaked with blood. Your next course of action is to apply a pressure dressing. Remove the initial dressing and pack the wound with gauze. Apply a splint. Apply a tourniquet. A. Apply a pressure dressing. Question 8. During full expiration, what is the maximum upward excursion of the diaphragm anteriorly? This is important because a penetrating thoracic wound at or below this line may have traversed both the thoracic and abdominal cavities. Second intercostal space. Fourth intercostal space. Sixth intercostal space. Eighth intercostal space. 10th intercostal space. B. Fourth intercostal space. Question 9. Traumatic cardiopulmonary arrest has a dismal prognosis. Performing CPR on a trauma victim puts pre-hospital providers at risk of exposure to blood and bodily fluids, and it also diverts resources away from other casualties who may be viable. Which of the following is not a reason to withhold CPR? A penetrating trauma patient has no signs of life, no pupillary reflexes, no spontaneous movement, no organized cardiac rhythm on ECG greater than 40 bpm. A patient has suffered an obviously fatal injury, e.g., decapitation, or evidence exists of dependent lividity, rigor mortis, and decomposition. Casualties of drowning, lightning strike, and hypothermia. A blunt trauma patient is pulseless and apneic on arrival of pre-hospital care providers. C. Casualties of drowning, lightning strike, and hypothermia. Question 10. Rapid and accurate patient assessment is important for the pre-hospital provider for which of the following reasons? Select 1. The golden period is the first 2 hours post-injury, and is the critical period during which the casualty must receive definitive care. The golden hour means that most casualties will survive if they receive definitive care within the first hour post-injury. The golden period means that many casualties have less than an hour to receive definitive care, and that the earlier the casualty can be transported to a facility to receive definitive care, the higher his chances of survival are. The rapid application of critical life-saving interventions during the golden period at the point of injury is not as important as early transport to definitive care. Delays in transport will extend the golden period, allowing the pre-hospital provider to provide definitive emergency treatment. C. The golden period means that many casualties have less than an hour to receive definitive care, and that the earlier the casualty can be transported to a facility to receive definitive care, the higher his chances of survival are. Question 11. During the primary survey, you attempt to manage your casualty's airway. Which of the following considerations is true? Every trauma casualty with a significant mechanism of blunt injury is suspected of spinal injury. Because you must maintain cervical spine stabilization, you cannot perform advanced airway interventions. You should immobilize the casualty's spine with inline stabilization and a spine board. Before attempting to open the airway, you must protect the cervical spine from excessive motion only if there is evidence of neurological damage. A. Every trauma casualty with a significant mechanism of blunt injury is suspected of spinal injury.